to Global Health Action's first webinar in our May webinar series. Thank you so much for attending. We are excited. This will be an incredible call today. And we do believe that even post this webinar, many will receive some information that certainly will be helpful and will be beneficial to their communities and to themselves as well. So again, welcome, welcome everyone. My name is Jenelle Williams, and I serve as the Director of Programs for Global Health Action. And I serve here in Atlanta with this amazing organization that has the mission of ensuring that communities are engaged throughout the world to improve the health and well-being, especially of women, children, and adolescents. We've been around for about 48 years. And we're excited today to share with you two incredible speakers, or guest speakers, as well as have an interactive discussion with you all. First, I'd like to share with you a little bit about our series. Our series is for May. It starts today, and it will be consistently on Fridays at 11 a.m. Eastern Standard Time, 6 p.m. East African Time, and that is also 8:30 p.m. India Standard Time. We'd like to share with you that you're invited, and please feel free to invite others as well. Today, our focus will be on the mental health, the impact of COVID-19 on our family, our children, and our community. And with that said, we have two guest speakers today. We have Edwina Pereira.
Hello. Hello.
Welcome, welcome, Edwina. And we have Dr. Brian Mcgregor as well.
Good morning, good afternoon, good evening, depending on where you are.
Thank you. Thank you, Dr. Brian. What I'll share with you is a little bit about the bios for each of our presenters. They will share for a few minutes, and post them sharing, we will have some time for a question and answer. What we're going to encourage you to do is, in your boxes, you should have the chat box available. And in the chat box, that is where you will be able to inquire, to comment, and to raise discussion questions. We really want to have an opportunity to discuss this issue and really begin to begin that conversation, hopefully continue it on post this call. So again, welcome, welcome. I'm going to speak a little bit about Dr. Brian Mcgregor. Dr. Brian Mcgregor is an assistant professor in the Department of Psychiatry and Behavioral Sciences at the Morehouse School of Medicine. He's also associate director for research at the Kennedy Satcher Center for Mental Health Equity at the Satcher Health Leadership Institute, where he oversees research and evaluation work, provides guidance and leadership to the staff in identifying funding opportunities for sustainability, development, and implementation of clinical and community-based research. He earned his bachelor's degree in psychology from Morehouse College and completed his master's and doctorate degrees in clinical community psychology from the University of South Carolina. He also completed the SHLI Health Policy and Leadership Fellowship Program in 2009 to 2010. Dr. Mcgregor served as a clinician and supervisor of mental health services at medium and maximum security correctional facilities in the state of Alabama from 2006 to 2008. Dr. Mcgregor's specific interests are at the intersection of behavioral health and criminal justice, with a focus on policies and programs that reduce recidivism, improve quality of life, and behavioral health outcomes. He is a founding board member of Physicians for Criminal Justice Reform and a national advisory board member for Forever Family, a nonprofit organization serving children and families in Georgia with incarcerated parents. Again, welcome, Dr. Mcgregor. And with that said, I will begin to share my screen. Give me one moment and we can pull up your presentation. One moment.
So hello again, everyone. Really glad to be joining you today. I'm sure some of you are zoomed out, but I appreciate you joining us and look forward to an enriching conversation when we get to that portion of the of our time together today. I always look forward to engaging and interacting with peers and colleagues and folks who very much in the same situation that I am. I want to thank Jenelle and Selena and the rest of the Global Health Action staff and my co-presenter Edwina. Really, just appreciate the opportunity to engage folks around these issues. I have a life partner who works in healthcare. I have two children who are school age and working virtually. So very much familiar with some of the stresses and strain of this time. So says host has stopped the video. Let's see. Okay, I guess we're okay. I'll keep going. So next slide, please. So just wanted to briefly talk about, just cover a couple of questions today. I want to touch on these two important questions, these topics from a mental health perspective. And that's simply, what are some of the mental and behavioral health impacts of COVID-19, particularly on families and communities? So, we often use the term behavioral health in different ways. So for clarification purposes, I'm referring to mental health, mental illness, substance use primarily when I use that term, because we're definitely seeing those kinds of impacts from the global pandemic. And then secondly, how can we strive for emotional wellness and optimal health during these stressful times? I mean, that's a question that we're all asking, and I think we're starting to shed some light on what the challenges are, and then what some of the solutions are. It's really important for us to get to solutions and not just talk about the problem, or at least attempted solutions where we can be effective in taking care of ourselves and each other. Next. So some of the things that we have already seen that are already being reported are definitely demonstrating and illustrating that we are experiencing challenges nationally and globally around mental health burden as it relates to the COVID-19. So NAMI was reporting a 300% increase in their cost of their mental health helpline. Same with NYC Well, definitely an increase in their inbound call volume. I thought it was important to include that on statistic from a particular state because they're so NYC or New York State is seen as the epicenter, at least for the United States, for the COVID-19 pandemic. So they're really really trying to adjust to the challenges that they've been faced with the incidents of COVID-19 diagnoses and deaths. Also, there was an 85% increase in gun sales in March 2020 compared to 2019 in the same month. While there wasn't sort of a thorough empirical investigation of why that might be, all indications point to people having fear and anxiety around what may be coming and having some fear around their own safety. And so, people do things like this when we're in times of global pandemic that causes a lot of stress and anxiety. We've seen it in other pandemics. There's definitely a fear of an impending mental health crisis. A lot of the conversation has been not what's necessarily happening now, but as we move through the different cycles of the virus, there's just a lot of fear around what may be happening. We're already seeing increased in some of those calls in domestic violence situations. People being in the same space. So this is presenting a challenge for a lot of families and communities. Next. So this is just a figure from the Kaiser Family Foundation. They just they did a random digit dialing survey of about 1,200 people and found that for the folks who were sheltering in place, and mind you, this was back in late March. This may look different and even worse if we were to take this, if they were to do the survey again today. But this is a figure of percent of adults who say worry or stress related to coronavirus has had a negative impact on their mental health based on sheltering in place status. And those who are sheltering in place reported a major negative impact and minor negative impact overall, and specifically higher in each of those categories than those who are not sheltering in place. So it brings on a new level of stress, having an environment where you're in, you're confined, so to speak, to your place of residence. You're not moving around. Your sort of normal routine is interacted and impacted. You're having to maybe navigate relationships in a different way. So it's causing a lot of stress and a lot of worry for people, and it's something that we have to attend to as a society, and particularly those in positions to sort of respond to these needs. It's important for us to know kind of what folks are dealing with. Next. So some of what this increased mental health burden is due to, some of the things that are bringing about these mental health challenges. So social distancing is definitely one of those things. Very early on, I sort of recognized, in part based on my training as a community psychologist, that what we're really talking about is physical distancing, not social distancing. And that was maybe more of a clarion call than an observation to say, let's make sure that we do stay connected. Because for some, social distancing means social isolation, and it can apply to in-home environments as well. For those who have multiple people in their homes, if some folks are leaving and coming back, where did they go? What was their potential exposure to COVID-19 while they were out? If it was to work, if it was to the grocery store, some of those things play a part in people's mental health burden. Unemployment and employment insecurity. So folks being furloughed, being laid off, businesses closing, all of these are challenges that folks are dealing with now, which is prompting many states to start the process of opening their state back up in terms of businesses. But still, the impacts that have been had even thus far will last for some for a long period of time. I have a lot of respect for employers who are trying to keep folks whole, but it's really, really tough, and placing a lot of mental health stress and strain on many individuals. There's increased parental responsibilities, overexposure to information about the pandemic, which we can get into a little bit later. There are individuals who are at increased risk that place a burden. Again, we're talking about these frontline workers, people who are coming in close contact with providing care for people who have COVID-19, potential COVID-19 diagnoses. Obviously, we're talking about individuals with pre-existing conditions, our senior citizens. So all of these folks are at increased risk, and they are dealing with the distress and stress around this issue, and certainly the family and loved ones of those at increased risk. We're checking up on them daily. How are you doing? Being exposed to these very, in many cases, traumatic situations causes us to sort of try to pull together to understand what this means and how we're being impacted. So, all of these are part of this increased mental health burden that we're going to have to deal with as a society. Next. So I like this slide because it broke it down into a couple of groups, like how we manage the anxiety. And I would say, other feelings too. This is not just focused on that feeling of, excessive worry and concern, but also, you may have people experiencing sadness and depression around managing the coronavirus. But, just a couple of things that I thought would be important to point out: avoiding excessive exposure to media coverage, having sort of that constant exposure to visual images and information can be overwhelming. And so limiting that while staying informed is certainly important. Connecting through calls, texts, internet, any way that we can stay connected with our friends and loved ones, relationships taking on a different status, whether they're your work peers, whether they're family members. So staying connected through multiple means is an important way to manage that anxiety. Adding extra time and for daily stress relief, practicing your self-care, focusing on your mental health, sort of focusing inward sometimes helps to create some balance and equilibrium as we try to manage this new norm. And then for children, reassure their children that they're safe, that you're doing what you can to protect them, that these changes are in order to keep them safe and not limit them or cause any kind of harm. Let them talk about their worries. Give them the opportunity to express what they're feeling. What impact this is having on them is an important coping strategy. Limiting news exposure and creating a routine and a structure, which is can be challenging given all the different responsibilities that parents, grandparents, and caregivers might be managing. But these are really important strategies that can help keep some of the anxiety and potential depression away. Next. So again, keeping each other safe and connected is everyone's responsibility. Obviously the states are starting to reopen, and I'm not here to necessarily take a position on what states should be doing, but your mental and emotional well-being will definitely be impacted by your ability to adapt to the changes that will undoubtedly continue. So if keeping your grandparents safe, who might be at increased risk, means you can't visit them in person, then you can talk to them. You can connect with them through calls, texts, and internet. My family and I have appointment with my mom and dad and my brother, who are in the same house every Sunday around 3:00. Just to check and see how they're doing. We would go over there for dinner pretty regularly. So it's important for us to stay connected and not be socially isolated, even though we're physically apart. So all of these challenges will likely continue, and the tools and resources that we have will remain really vital in terms of our ability to cope and be resilient. Next slide.
Yep.
Okay, so yeah, I just wanted to give some broad strokes to what the mental health challenges are looking like. I'm assuming we'll get into more discussion moving forward in the Q&A section, and I'll turn it back over to the host and look forward to Edwina's presentation. Thank you.
Fantastic. Thank you so much, Dr. McGregor. And, again, we connected through our work around families impacted by incarceration. And, I think would love to continue this conversation really about when we start talking about now marginalized communities and the impact there and what that begins to look like. And would love to see that. But thank you so much for sharing this presentation.